Okay, so let's talk something about the healing of a fracture, how a fracture heals, right? So normally what we read that there are 5 stages of fracture healing, stage 1 to stage 5, where the stage 1 we say is the stage of hematoma. Into this hematoma starts your second stage, that is the stage of inflammation, and then it starts with granulation, right? This stage then converts into stage number 3, that is what you call the woven bone formation. Okay, that is what you call a soft callus, and then mineralization occurs into it. It becomes a hard bone. Okay, this is what you call a lamellar bone, and then last stage is remodeling. That is what we read traditionally, but how it goes on actually, right? How it goes on in real. See, the sequence the sequence of events basically that happens in any fracture, it goes something like this. First stage is always the inflammatory phase, we say, right? Then it goes into the stage of repair, and then it gets into the stage of remodeling. How these 3 steps or how these 5 stages help us in the healing of the bone, let's talk about it. As soon as there is a fracture, what happens? As there is a fracture, there is a damage to the blood vessels, and what these blood vessels will form, they form a hematoma, and that marks your stage number 1, right? That is your stage number 1. Now into this hematoma, what happens? This is the first step. Now second is, into this hematoma, what will happen? Into this hematoma, there starts the inflammatory cells invasion, right? First the hematoma is formed, and then the inflammatory cells, they start invading the hematoma. These inflammatory cells, what they do, they initiate the lysosomal degradation of the necrotic tissue. They start eating them, removing them. Basically the purpose is to remove all the dead tissue, right? Now this first process of hematoma, definitely it starts within first few hours, right? This is in first few hours. This second process, what we are saying, the reparative phase, these what they will do now, once the lysosomal degradation of necrotic tissue has started, then what happens? These mesenchymal cells, basically, which are the mesenchymal cells, what they do, they then differentiate into different other kinds of cells, right? Mainly 3 categories. First is fibroblast, right? That helps in the formation of your soft callus, and then into chondroblast, fibroblast, chondroblast, and then number 3 at last into the bone forming cell, that is your osteoblast. So now the mesenchymal cell, they get differentiated into different kinds of cells. This process starts within first 4 to 5 days after fracture. So the cell starts proliferating or differentiating into these 3 kinds of cells, right? Now when this proliferation starts, what they do, this stage forms soft callus. So here we have already got into the third stage of the fracture healing because of proliferation or differentiation of the mesenchymal cells. Now when the process of mineralization occurs into it, right? So into this soft callus will start the process of mineralization. Now when the process of mineralization starts, then what happens? What we get after this is what you call a strong bone or a hard bone. We get a hard bone, right? So after process of mineralization, we get a hard bone which has a strength almost equal to the new bone, right? This phase, this hardening phase, now it tries to get the bone back to normal strength. This stage may take months to years, right? This is basically how any fracture heals, right? Now sometimes they ask you why the fracture don't heal. See, fracture healing is basically influenced by four major factors, right? So point is about the factors affecting the fracture healing. What are the factors which affect the fracture healing? We should know them in brief, at least, why the bone is not uniting. There are basically four main factors. One, we call them as systemic factors related to the patient, the systemic factors, right? What do they include? The systemic factors, they include the age. Older age have definitely more problem in healing of the bone as compared to a young bone, right? Second is nutritional status of the patient, right? Malnourished patient definitely will have lesser healing power, right? There are multiple others, meaning by, like, third, any disorder, any disease associated, like diabetes, like patient is anemic, anemia, like patient has uh, diabetes, and then neuropathies. So if the patient is suffering from some disorder, then these are known as systemic disorder. Patient is addicted to something like alcohol, nicotine, these are known to delay the healing of the fracture. That is one. This is how we can divide the first factor. Second factor can be any local factor. Second can be any local factor. What does that mean? It means what kind of bone is injured. It depends on type of bone. Cancellous bone, they heal good. Cortical, take some time. It depends on type of bone. Is the fracture because of some abnormal pathology? Maybe because of some tumor, maybe because of some radiation necrosis, maybe after some infection. So if the bone is having some local lesion, then obviously there will be delay in the healing, radiation necrosis. Third factor can be depending on the treatment. It is depending on treatment. For example, if you are putting some implant, right, and if you have not corrected that on perfect position, so this implant can induce a difficulty or an altered blood flow that hampers the blood flow to the bone. Okay. Second, contact between the two fracture ends. Contact between two fracture ends. Are they impacted? Is there a gap? Are they displaced? Is there over distraction? All these lead to difficulty in union of the bone, right? So this is third category. Fourth category can be some associated complication. Obviously, if a surgery, if a fracture is related to some sort of complication, there will be definitely healing problem. Like if there is some associated infection, like if there is some vascular compromise, meaning by some venous stasis, if the patient is known to have an allergy to the implant use, so metal allergies. So these are some factors which delay the healing of the fracture.